Thanks for staying with us, everybody. January 2nd, state lawmakers head back to the Capitol for the 2024 Mississippi legislative session. And joining us with the preview, State Representative Kevin Felsher. Representative Felsher, good to have you on board. It's right around the corner, just a couple of weeks. I'll throw you just kind of an open question. What do you think is going to be maybe the biggest issue in 2024?
Probably PERS, the state retirement system.
It's in trouble?
We're looking at it. It's about 61% funded, which is low, 20 billion in the hole, which is high. So we have to look at it and see what we can do. We need to increase the incomes and decrease the outgoes.
Yeah, but everybody says that. This isn't anything new, but everyone just keeps kind of kicking that can down the road and ignoring the public retirement fund.
Well, we don't have that luxury anymore.
Because we have to, by law, have a balanced budget, or because it's in so much trouble?
Just all the red flags are up that something needs to be done, and we have the leadership, I think, right now to do it, and I think we will.
I didn't think you surprised me. I didn't think you were going to say PERS, because I think that's important too. One of the big things is longtime Speaker Philip Gunn, no longer in charge of your chamber. You have Jason White, a little more moderate, I understand, than Philip Gunn, more likely perhaps to work with Democrats. What do you think is going to happen?
Well, I think we do have a Republican supermajority. There's 79 of us, but I still think you'll see some bipartisanship there. That is the spirit. But I must say Speaker Gunn also had a sense of bipartisanship and would bring people across the aisle and work with them. So from that perspective, I don't think there will be much change in the sense that we've always worked good with our Democrat friends across the aisle.
So Governor Reeves has been pushing the total elimination of the state income tax. I get the feeling that legislative leadership is not ready to go there yet. They've already said it. Delbert Hosemann has already said it.
Sure.
But then there's the grocery possibility of eliminating the grocery tax. How big is that going to be?
Well, it's huge. We're hearing a lot about it. Now, we just passed a $600 million tax cut 2 years ago. That's still being phased in, which will bring us to a 4% flat tax. And then the grocery tax, which we looked at eliminating at the same time, $250 million, I believe, is what it would have cost us to take it from 7% to 3.5%. So we have to look at how we would fill that $250 million hole if we were just to cut it in half. So, but I do think it's a discussion that we need to have.
Yeah, I think it's a popular thing to do. And we live in a world where $250 million isn't what it used to be. It's not that much. So I think you can probably plug that hole. And I think, again, all across the state, I think that'd be a populist issue.
Well, I do think that everyone buys groceries.
Yeah.
And I do think it's a way that everyone could be helped. So I think it's something we need to look at and see if we can do it.
Okay, on the health care front, there are really two things. The hospitals are in trouble, not so much here on the coast, Singing River Memorial doing better than hospitals up north of Jackson and into the Delta. But, and the governor has come up with this kind of Medicaid reimbursement plan that does help the hospitals. What do you think?
Well, we know that it was just approved by CMS, and it's supposed to generate about $680 million in extra revenues. So I'm optimistic about it, and I think they've found a way to leverage federal funds against state funds. So hopefully we see some production out of that. As far as Medicaid expansion, I think we do need to look for our working poor, what we can do, if anything. What we don't want to see is our Medicaid rolls get bloated with an artificial sweetener of 9-to-1 from the federal government, and then they pull back, and the Mississippi state taxpayers on the hook for the remainder. So we do need to look at options we may have.
Maybe kind of a hybrid plan instead of full-blown expansion. Be creative and come up with something.
Something, or maybe even an employee incentive or something like that. Well, what we've seen in other states, David, is the employer, when you do Medicaid expansion, the employers will dump their employees a lot of times onto the Medicaid rolls and quit paying insurance for them. So it expands the Medicaid rolls. We have to be very cautious in what we're doing, but I do think we need to give it a look.
I'm a big fan, and I think the legislature the last 2 years has really dropped the ball on restoring the ballot initiative process. Another very popular thing.
Right.
Well, unpopular, that legislators haven't done anything. But people want the right to vote on issues. They want to see it on the ballot.
Right.
Not easy to get to the ballot.
Right. So for the past 2 years, we've struggled with that. The main change that needed to be made fundamentally was take it from 5 districts to 4. That's the easy part. The harder part is what's the number of signatures you're going to require to have a ballot initiative move forward. That is, the Senate side has had it about 200,000 plus signatures, the House around 95 to 100,000 signatures.
I like the House plan.
Yeah, but we haven't been able to get traction with our Senate counterparts. And this year, I feel like with the people wanting it, and this being the third time, I hope 3 times is a charm on that one.
I think folks here on the coast need some help with, obviously, insurance rates. I don't know what the legislature can do.
Right.
But homeowners and businesses were getting killed by FEMA rules, by the insurance companies. We don't have a lot of power, a small state like Mississippi.
Right.
And I think it's like a major crisis.
Yeah, really quickly, we got to help ourselves on that one, and we have been doing that. We've contracted with SMPDD to come up with kind of some maps, to a map program to challenge FEMA elevations where they're wrong. That project, from my understanding, is near completion. Those maps will be available. From a wind pool perspective, I think Senator Delano, Representative Zuber, and some others are working on some sort of mitigation program where if you put a new roof on your home and it meets these codes, you would get a mitigated cost for your insurance. That's something that's being looked at. We have to do something.
Yeah, we have, because it's not going to get any better.
No, it's only getting worse, and believe it or not, Mississippi is better off than Louisiana and Florida right now as far as rates and the extremes of insurance that others are seeing.
Okay, now you haven't been in the legislature very long, but one issue you've really embraced is mental health. What are your goals with that?
Well, this year it's to enhance 988 crisis hotline. We want to see that that's put on back of driver's licenses and student IDs for to make sure people know, for awareness. Also want to improve the commitment process. In my opinion, our commitment process is flawed and it needs to be improved. I'll be working on that. And we want to see come to fruition the Harrison County Diversion Center, which will be a single point of entry for law enforcement officers. When they come into contact with someone with mental illness, they will have somewhere to bring them and they can get acute care right then and there and not be tied up in an emergency room or with a police officer for an hour or two.
All righty, well, good luck with that, Representative. Kevin Felsher, good to see you. Thanks for being with us.
Appreciate you having me,
Okay,
David.
good luck when you
Thank
head
you.
up to Jackson.